if it's not the flu, it's COVID, RSV, or norovirus. There is a lot going around, and it's being called the quad-demic. Joining us to talk about how we can stay healthy is Karen McGoldrick, infection preventionist at Sentara Leigh Hospital. Thank you for spending some time with us.
Thank you.
Yeah, we're hearing so much about the cases on the rise. What are you seeing at Sentara Leigh?
Well, it is January, so it is fairly common that we see an increase in respiratory illnesses. It always seems to increase in the wintertime. We are definitely seeing a lot more of influenza this year. A lot of people having to be hospitalized with it. We see a lot in the emergency room for all of them, but particularly right now in our hospital and most of the ones in the area, we have a lot more patients admitted that have the flu than have COVID. That being said, we also have several, probably 5 or 6 at a time or something, admitted with COVID, RSV, a few of those, and then there's a few other respiratory illnesses too that people have. So those are the main things.
So people obviously can still get the flu shot,
Yes.
and I know every year at some point they'll say whether or not the shot is really good for the strain that's out there. What are you seeing in terms of that? Not
really sure. I'm thinking it's kind of looking like it wasn't 100%, obviously, but it's probably not much different than it has been in the other years. I'm not sure if this year more people maybe didn't get a flu shot, and that sometimes has happened too. People kind of get tired of getting flu shots, and maybe that's some of it. We're just not sure whether it's people that didn't get the vaccine. I know of some that got the vaccine and still got the flu, but it just depends, yeah.
All right, and so symptoms. Norovirus, that's out there too. That's more of the stomach bug.
Right.
What are the symptoms there?
Okay, so right now in our part of the state, we haven't had as much of the norovirus. It's been in the other parts, but most recently they've told us it's starting to spread here now. So for that case, it's usually fever, headache, nausea, vomiting, pretty much extreme nausea and vomiting. People usually know it if they have it, and people always call it the stomach flu. It's not really a flu, but it's usually norovirus. It is highly contagious. The best way to prevent spreading it, usually easily spreads among family members, you know, kids in school, et cetera. It's usually spread by touching surfaces, so washing your hands is very, very, very important with soap and water. That's the best way to kill it, and also to keep from spreading it, and then also to wipe things down with bleach. Not everything else always kills that virus.
Yeah, it's a stubborn one.
So it is. And that's one that usually the symptoms last several days. And then you know, and like I said, it's easily spread among family members. The best thing is to stay home. Don't expose others.
Good advice. Thank you so much, Karen. We appreciate it.